Hello everyone, welcome back to 1 Minute Talk. Today in this video we are going to discuss about the normal breath sounds. We have two breath sounds, vesicular breath sounds and bronchial breath sounds. Let's differentiate. Vesicular breath sounds, longer inspirations and shorter expirations. Vesi for longer inspirations, ve for the shorter inspirations. Remember, vesicular breath sound is reduced breath sounds. Next one, bronchial breath sounds. Inspiration and expiration both are equals. Just remember, bronchial breath sounds is louder breath sounds. Let's listen. Now discuss some abnormal or added sounds. First, rales or crackles. Just remember, rales affect the tails. Tails means alveoli due to the fluid overloads. Listen. Next, bronchi. Just remember, bronchi affect the bronchi. Example, COPD. Next, wheeze due to the narrow air process. Example, asthma. Let's listen. And last one is the stridor due to the upper airway obstructions. If you have any doubt and suggestions, please comment. Thank you.